took the decision of choosing neurosurgery over other branches of medicine?
Invention of the CT scan, which actually started revolutionizing the interest in neurosurgery.
Neurosurgery is called one of the most toxic branches, especially this 6-year course. You have seen so many happening, especially in the JRs.
I have seen the same thing with my student.
So what about the inhumane long working hours, the 36-hour duty, the 48-hour duty?
Yes, very true. It's a issue which is now propping up all over the world.
How much more potential do you think this branch has in the next 10 years?
It is not going to be a dying branch.
So why do you think doctors are so underpaid in our country?
Doctors are...
Uske baad bhi you are always afraid that somebody can come and beat you up. How much can a neurosurgeon earn in his lifetime? Hey guys, welcome to the Nachiket Bhatia Show. Today we are going to discuss the branch which was most requested in the comment section, neurosurgery. We have a very esteemed guest and we have discussed every aspect of this branch, the toxicity behind the 6-year course, whether the MCH is actually worth doing. Will general surgery continue to exist, or will doing MCH or DM be a must for every aspiring surgeon or physician? Let me introduce the esteemed guest. He is a BC Roy Awardee, Vice Chairman and Head of Neurosurgery at Max Super Speciality Hospital, Saket, and former Director, Professor and Head of Neurosurgery at GB Pant Hospital. With over 35 years of experience, more than 12,000 complex brain and spine surgeries, and 250 plus scientific publication, he is one of India's most decorated neurosurgeons. He has trained thousands of MCH applicants, and I'm telling you, you're going to love this episode. Let's put our hands together and let's welcome Dr. and Professor Daljit Singh. Welcome, Dr. Daljit sir, to the Nachiket Bhatia Show.
Hello, thank you.
Sir, you are a legend of the field of neurosurgery. And you have spent, I think, decades in the field, sir. You have done everything possible in this field. So before we get into the field as neurosurgery, I would like to know your beginning. Where did you start? How did you enter the field of medicine and the journey ahead?
Okay, thank you for calling. Lovely meeting you all, and appreciate the objective of such a talk. Not only for me, I had a chance to listen to some of the other podcasts by you. That's a very professional way of saying everything. So I started my career as a student in Allahabad. I was born there. Okay. Then subsequently my dad got transferred to Delhi, so we moved to Delhi in East Delhi. I studied in government school because there were no big school at that time, and then most of us belonging to that age group of 60s were from lower middle class. That was the precise truth with all of us. So education started in government schools, and thereafter the schooling, I was a good student, doing well. In those days, everybody wanted to be only a doctor or an engineer. There was no other third profession for those who were good in studies. So wanted to be a doctor, but unfortunately did not get it in first go. So landed up in second attempt. But during our time, we did higher secondaries. So college 1 year was mandatory to be done. I was in Kirodimal College for a while before I got into MBBS in Maulana Azad Medical College. So that is how my life started in medical profession. I joined in 1980 at MAMC, completed my MBBS in 84, then internship, house job. There I wanted to do MD medicine / MS surgery because I felt I could do both of them equally, whichever I get. But somehow I had a preference for medicine, and subsequently I wanted to do neurology. But I did not get medicine in my first list. So second choice was MS surgery, so I joined MS surgery. In the second list, I was sure to get my MD medicine, and me along with one friend of mine in AD Harding, both of us wanted to shift from surgery to medicine. I was number one waiting, he was number two waiting, and for almost 2 months before the second list was announced, we were debating whether to continue in surgery or to switch on to medicine. So, why I'm telling, because in the life they come across situations when you have uncertainties, and that was a big, big uncertainty for me. Then one fine day, the last day of change, both of us decided to change, and I went to science faculty, seventh floor, to change. So when I reached there, it was almost 4 p.m. in the evening. I was waiting for this friend of mine to come, and both of us wanted to change. So he could not reach. So somehow I was again, disturbed. I wanted to change, so he has not come. So I don't know what was happening. It was not in my understanding. I climbed down the seventh floor, came down, and again started thinking. Then one thing, struck my mind. I had come for a change. I have not changed. I have come down via the stairs, and I said, now I'm not going to change. Okay. So I took my bike and came back home. In the evening, I spoke to that fellow. Why have you not come? You have ditched me, so I'm not changed. He said, you have ditched me. I was there and I didn't see you. I said, how come? So we matched the time. He was actually there. He changed his subject from surgery to medicine. But while I was climbing down the stair, he took the lift and went up. He changed and I did not. So, that was a destiny, change which had to happen for me. So, nature had given me surgery. I wanted to shift to medicine. Nature did not allow me to shift to surgery. And I came down. Today I realize how the nature plays. If you trust the nature, if you trust the God, leave it to Him. He'll make decisions for you. So that is how my journey to surgery started. And subsequently, after doing my surgery, then I thought, okay, fine, let me go for neurosurgery. I took neurosurgery, went on. There were a lot of struggles in neurosurgery also. But I say, without struggle, success is meaningless. The importance and the relevance of any success get exemplified if you have faced a little bit tinge of failures in your life. And there are 2 3 messages in that. You enjoy it more, it gives you confidence, it gives you courage, the meaning of the success has importance in you, and then you set an examples for others also. Don't be afraid of failures in your life. There are much more success written through a different route than what you believe to follow. So that is how I became neurosurgery. And but then, I wanted to remain in academics, and there was no post after completion of my MCH Neurosurgery. I joined private sector for almost for 1 year. Then came a post of pool officers. That used to be a bridge between the senior residency and assistant professor. So I did pool job for almost 2 year plus. Then came only one seat of faculty was available, and there were many candidates who appeared. By luck favored, I got direct promotion as associate professor of neurosurgery without ever joining as assistant professor, because that was the rule on those times. Became faculty in Maulana Azad Medical College, GB Pant Hospital. That was a one complex. Continued there till 2024. And in 25 April, April 25, I took VRS and left my alma mater where I served for 35 years plus. And now I have joined as Vice President of Max Neurosurgery at Max Super Speciality Hospital, and head neurointervention there at place. So transition from academics to quasi-academics, I will say, not completely money-making place. The life has been full of achievements, success, rewards, full of stories. I have been fortunate to have trained more than 150 MCH students in GB Pant Hospital who are venturing neurosurgery across India. Some are settled abroad. And that's very satisfying in itself in terms of my journey in medical profession so far. It's not an end. I'm very sure much more are still to follow.
I have a complaint. 90% of you have still not subscribed to the channel. So before moving forward, please go ahead, press the subscribe button and click the bell icon. So you have also been awarded the BC Roy Award. So tell us about that.
See, in medical profession, Dr. B.C. Roy Award is considered as the highest award in medical profession, and fortunately, it has number of categories. The best category is considered the Eminent Medical Teacher Award. So, 2016, I was awarded that Dr. B.C. Roy Award by President of India, Pranab Mukherjee Sahab, and I mean, I've had number of awards in my life, including BC Roy. But my most cherished award still remain is Distinguished Alumnus Award from Maulana Azad Medical College. You know, when your own peers, your own colleagues, when your own teachers, when they feel a person is fit to be given alumnus award, I think that succeeds, that supersedes even the Padma Vibhushan and Padma Bhushan, because that's a slightly different kind of an award. You know, your own colleagues consider you worth, and nothing can be more rewarding when your own colleagues trust you suitable for alumnus award. But then that's where Times of India gave me Legend Award. I am recipient of Delhi State Award also, beside many, you know. But then whenever somebody asks me, I said, nothing beats me the Distinguished MAMC Alumnus Award.
So I think you are the best person to ask this, sir. I'll ask you this. What makes MAMC special?
That's very interesting. You know, when we joined MAMC, it was something, nothing like special. You scored well, you got MAMC. That was the thing, and it was in Delhi. It was rated as one of the best medical college, so we joined it. But what makes me MAMC special was, I'll say, uh, it had a extremely good faculty at that time. You know, students were also very much involved in learning, teaching, patient care. So that, you know, that collective wisdom which was imbibed to us by the culture of Mulanians and Maulana Azad Medical College was phenomenal. Actually enjoyed during our time. So that is scaling down. So that is not MAMC alone, a medical profession overall in the transition because of some of these reasons.
Would you still consider MAMC one of the best institutes in the country?
Precisely, if not one of the best, to be honest, answer would be we have had many institutions in the last 50 years which have risen up to the level of MAMC. Okay. And that's true also. And in a way, it is good that somebody is copying itself equivalent to MAMC. They want to raise their standard to MAMC. So, you know, there is a attic of any institutions which has been achieved by the MAMC to some extent. And it is maintaining that ethical higher scale is more difficult, and coming up to that level by other institution is easier. So what I found that many institutions which have come up subsequently, it was much easier for them to come to those level than rising above the standards of what MAMC has achieved so far. But saying that, yes, there is still a lot of scope for MAMC to go ahead matching to international standards rather than competing only to Delhi level or all India level. I think we are lacking there. Our exposure to international level medical education has gone down. I'll add on to when MAMC started, the most of the faculty at that time had training abroad. They had started that medical college in Delhi, and many other institutions, those who came up during those time across India. Okay, so that's how it started. Somehow our exposure to those branches and those level of change which has happened over the last 5 decades has not translated into the upscaling of the high-end medical institutions so far, and that's one of the reason. And perhaps we have not had the support required to make that kind of a upliftment which is needed to bring up the standard of up leveled medical institutions like MAMC.
Sir, I think you are the best person to ask this particular question also, because I think every topper, every ranker who has got a great rank in NEET PG or INICET goes through this thought. What would you say is the main difference between AIMS and Maulana Azad?
Okay. See, one is today AIMS is getting some of the best brain, no doubt about it. Okay. And why? Because AIMS have been able to sustain that level of superiority, level 1 over the number of years, which any ranking system or organizations is imbibing. They have maintained it. There is a phenomenal difference in the budget allocation of AIMS vis-a-vis any other institution. The difference is more than 5 to 6 times of the budget allocations. The faculty of AIMS have a obligatory research things to be done before their promotions, which is not there in other places. Okay. Then the support system by AIMS, being an autonomous organization, has a lot of advantages which have them the freedom to work vis-a-vis other places which are under the control of the government. And when certain things are under control of A, B, or C organizations, it is a human tendency, believe me, that people will work to please their superior, and the superior will exploit to some extent the advantages of their superiority. That takes away the cream's advantages, even if one is working in Maulana Azad or its equivalent, which perhaps AIMS is not having to that extent which is existing in the places like here. Salary difference is phenomenal between the MAMC faculty vis-a-vis AIMS faculty. Allowances are different. The travel advantages, research are different. The number of leaves granted between the AIMS versus Maulana Azad is different. So, this parity, it's not, the mind is same. I mean, the human brain which is coming to AIMS versus human brain which is coming to MAMC, they're all same. The rest is polishing of that brain in order to make them work the way it should be working, and the provision of the facilities to them is not of same standards.
So let's talk about neurosurgery.
Right.
So you have been a legend in the field, but I will ask a personal question before that. 99% doctors are marrying doctors only. You married outside the fraternity. So how does a medico-non-medico relationship work?
See, that's a very, very important question, not only because I married to a non-medico. My wife is a high court judge. And when I married, she was already a judge. So been in an alliance for more than 35 years. But then, I was also looking for a medico. We didn't get the kind of spouse in medical field which I was looking for, or not I was looking for. When it is a planned marriage, it is a family looking for rather than you looking for a spouse alone. I believe in that. So it wasn't happening that way. But then with my experience of 35 years, I think my personal opinion is medico should not marry a medico. Okay. I'm very clear on that. The reasons being, maybe medico understands your professions, your responsibilities, your tough duty hours easier than the non-medico. But then you learn lot many things about the life livings requirement, other discipline, other field by simply marrying a non-medico, because I learned so much about the law, legality. I'm not a law graduate, but my knowledge has been so because I've been hearing those things at home. You imbibe by virtue of listening to them, and slowly people say, अरे यार तेरे को बड़ा सारा law आता है. And same is happening with my wife. तुम तो आधे डॉक्टर बन गए हो because you've been listening. So I'm very open to that. It should not be a restriction to marry only for a doctor. And that's a message to my young student who are in the matrimonial age. There is nothing wrong if you choose a non-medico in your life. Life is not marrying a profession, it is you're building a relationship with a spouse, which is dependent on so many other things rather than the profession alone. If you have difficulties, you will have difficulties with the medicos also. If you are not having, how to conduct yourself, how to live, then any profession or even non-professionals are okay, provided you know how to live and scale in your life in the sea of ocean of marriage difficulties and all. But it's straightforward. I mean, my answer is simple: not necessarily should marry a medico.
Thank you, sir. That's a very different perspective that you have given us. So let's talk about neurosurgery. Back in your own time, you took the decision of choosing neurosurgery over other branches of medicine. What was the reason behind it?
I don't know. Again, maybe when we chose neurosurgery, I mean, I divide neurosurgery in three, phases in India right now. Before 1990, somewhere from 1990 see 2020. Okay, now that is matching with the rest of the world. From 1930 to 1980 somewhere, the neurosurgery was considered one of the most difficult branch of medicine. And it used to be said the graveyard of medicine is the neurosurgery ICU, because mortality was 80 to 90%. Okay. Today, the mortality of neurosurgery is less than 5%, matching with any branches of the surgery. And that transition, I'll say metamorphosis, which has happened, is primarily because of much more understanding of the functioning of the brain anatomy, the gadgets which are now available to operate neurosurgery. The biggest change to my mind was invention of the CT scan, which actually started revolutionizing the interest in neurosurgery. When we were working as a house job and PG in MAMC, the neurosurgery resident from GB Pant Hospital used to come for to angiography for all brain procedures. Head injury patient will come, they will do angiography, which used to be carotid puncture. Okay, so carotid angiography, they'll do the puncture, take a shoot of the angiographic film on table, on the operation table, will draw some conclusion based upon those angiographic film, which at times used to be wrong. So we'll open the brain on the right side. Sometimes you don't find, let's open the left side, because there were false positive negative results. And when we used to see those cases, used to feel neurosurgery nahi karni hai, kuch bhi ho jaye. It was so tiring, so disturbing, and used to be time consuming, yet the results were very bad. Then came the CT scan. CT scan started showing things inside the brain, and that is, believe me, the best gift the mankind has had so far in the treatment of brain lesions. Their modifications, subsequently MRI and those things have come up. But then that made things a little bit more understanding about the pathology in the brain. Then invention of microscope, intraoperative neuromonitorings, lasers, ultrasounds in the brain, ultrasonic aspirators, O arms, C arms have made tremendous change in operation field. What we used to do, some like acoustic neuroma surgery, which used to take 7 to 8 hours, sometimes more than 24 hours, is now possible to finish in 3 hours. Just because understanding has improved, microneurosurgery has improved significantly, and one is able to give results far better than what it was. And also added, the very important point was the understanding and advancement in neuroanesthesia. The brain swelling, which used to happen during the operation, the brain used to bulge out, doesn't happen anymore. There are very good anesthetic agents which are available now. They can control the functioning or swellings of the brain, control the blood loss, okay, increase the blood pressure, control the autoregulations aspect also. So anesthesia, particularly neuroanesthesia, has advanced significantly. It has become a new branch altogether. So that is the transitions which we all have seen over the years, and that has made a remarkable change.
So, in the field of neurosurgery, there are basically two courses that are going simultaneously. There is an MCH course, of course, and then there is a 6 year MS or a DNB course. How would you differentiate both of these?
That's a very good question. And very often, these questions come up. See, one has to understand neurosurgery is not taught during the MS altogether, or it is just a little bit of exposure. But then we did, my time, I did 2 year MCH course. Ours was the last batch for the 2 years. Then came the 3 year MCH course. Fine. Largely, it is felt that 3 year course vis-a-vis 5 or 6 year course, the performance in field of neurosurgery is better if someone has spent 5 to 6 years of courses. Okay, one very simple straightforward, because somebody is exclusively trying to study the neurosurgery in right from the beginning after the MBBS, whereas they are still exposed to the general principle of surgery by virtue of rotation from discipline of general surgery for some time, which is giving them the exposure to the field as surgeon. So this debate over the years has now come to some sort of a conclusion that we are producing better neurosurgeons if they have spent 5 to 6 years after MBBS. Okay, because in nutshell, I've realized they are doing better, in the field also. Their exposure is more. Having said that, there is a caveat attached to it. What happens is student joins a 6 year course or a 5 year course, and he doesn't like after 2 years. So his career is little bit difficult. He is without any MS surgery degree. He cannot opt for any other super specialty branches. Okay. So I'll say someone who is not sure what super specialty he wants to take and is open to take more than one branches, he should not come to neurosurgery right from the beginning. Should first try general surgery, get an exposure, because he's not seen neurosurgery, that the difficulties involved in the neurosurgery training versus other branches. And those who are very clear in their mind that I have to do neurosurgery even after my MS, they should try to come to the directly for the 5 to 6 year courses, because for them it is much more easier. Those who are unsure of their themselves, they should not directly venture into that. Otherwise, there can be frustrations. You may not like it. Then sometime you're compelled to carry on those 5 to 6 years, or you leave it, or you land up into depression and some sort of disorders associated with the stress.
Sir, neurosurgery is called one of the most toxic branches, and especially this 6 year course. Why is that?
Yeah, that's what I was trying to tell you. Actually, I'll not use the word toxic in a way, because toxic means something difficult. I'll say it is demanding branch. Okay, demanding branch in such a way that the brain is unforgiving organs, and your commitment to observations to the patient's conditions in neurosurgery changes in a minute. A patient may be walking, talking, and death. And if you do not keep surveillance on those parameters, in way, you may lose a patient all of a sudden, or may lose a body part of the patient if you're not very careful. So the scope of error in a neurosurgery is limited. Okay, and one has to catch on to those events which can lead to catastrophe right in the beginning, anticipate, see before it is too late. And that's why, one has to be vigilant, be present physically as well as mentally on to the patient pre-operatively, intraoperatively, post-operatively. So be careful. Then, you cannot be called it as toxic because you are working, have to work. Please also remember, there was a time in 1932, 70s or 80, the neurosurgery, nobody was going. There used to be 1 or 2% going. Today, people are opting neurosurgery as first choice because seeing the potential later on, success rate, as well as the results are very much gratifying. Neurosurgery is tremendously changing from what we had done. What I learned, what I have taught to my student, today I find, and every 5 years, these things are becoming slowly obsolete. New things are getting added on. It's one of the fastest changing branch in medicine is neurosurgery. You must have heard Neuralink, the chip being employed in the brain. I mean, we are going to that stage. When I was doing my MCH neurosurgery, we had just started reading on applications of the computers, robotics, and AI in neurosurgery. We had started learning. Today has become a reality. And you'll be surprised the things are changing so fast that the future of neurosciences is very, very different from what you and me learned. What used to be fiction is turning out to be reality in 5 decades. And that is going to be a big ethical concerns. I'll call it as neuroethical concern in a time to follow. So let's not assume it is a toxic branch. It is a rewarding branch. It's a very, very rewarding if you see the results, which used to be 100% mortality to now 1 to 2% mortality. So, one has to, the generations have worked over the years to produce the result like 1 to 2% mortality. So that toxic phase is over now. It is now more of a enjoyment if you know how to do it. That is how the teacher's responsibility will be at this given situation.
So, what about the inhumane long working hours, the 36-hour duty, the 48-hour duty?
Yes, very true. It's a issue which is now propping up all over the world. Okay, and it's not India. All over world things are going on, and I very distinctly remember we had no off, no post duty off, and we used to crib. Okay, believe me, we also crib. क्या है इतनी ड्यूटी, इतना लंबा ना घर है ना कुछ हृदय इसमें. But then one has to understand medicine is a different kind of a field. Okay. More time you spend on your patient, more peaceful you will be in the later part of your life because you learn during those struggle filled period. Okay. And that's I'm saying one side. Spend time on the bedside, talk to the patient, see them. It has a different kind of sense of belonging, satisfaction of your profession, and great learning, which has made most of the Indian doctors superior to rest of the world, because we do not counted the number of hours being spent. Now, having said that, today expectations are different. People want time for self also, and we are teaching, preaching. Everybody's saying you should look after yourself also. That also goes on simultaneously. The number of doctors are never going to match with the population. Population is rising in a much more exponential way than the doctors. So this disparity would remain. Now, if we actually follow the number of duty hours, that will be very nice for the doctors which are coming. They have a right to take care of their health also. But the trouble is, we do not have adequate manpower to cover up those situations. Now, I am familiar with my very good friends across the world. They're finding a difficulty in US, UK. Their law does not permit a resident to work beyond a particular hours, and they say, my duty hours is over, we are leaving. And they leave. They are protected by the law. But then fine, in those situations, the consultant is it's obligation for him to take care. But consultant also has at an age, a 60 years old, 65-year-old, 70-year consultant is not expected to do that much of physical work which a 30s boy will be able to do it. As a result, what is happening is people have started taking less number of cases. So it's not possible physically. So who's suffering? Ultimately, the patient, the care will be suffering, patient is suffering. So I do not have exact answer how to bridge that kind of a difficult situation. Yes, every profession people are leaving after 8 hours of duty. Why should medical not leave? They have every right to leave.
That's a very honest answer.
Yes.
That's a very honest answer. So, what's the career graph like after doing your MCH or, like, suppose 6-year DNB? What's the career graph?
So, in neurosurgery particularly, from our time to now, there are, after super specialty, there are various sub-specialties have evolved. Okay. Like for people of my generation, I do every part of the neurosurgery. with almost covering up 90 to 95% of the neurosurgery, because we belong to an era where the neurosurgery has come up. Now there is a subspecialty like endovascular, stereotaxy, functional neurosurgery, spine surgery, pediatric neurosurgery. So there are many things, and in future there will be stem cell neurosurgeries and all those things are coming up. Gene therapies, all things are getting added up. So there is a provision to have subspecialties. One should try to have more exposure after your MCH or the DNB has been done, and one should try to spend time 1, 2, or 3 years depending upon the various courses in this. For the new generations, they must do it. And why more important is, like, unfortunately we realize, I had been the president of Neurological Society of India, and at national level we understood that there is a big gap of training across the country in various institutions. Okay, at one place some specialty is not existing, at another place some is not existing, at third place there is nothing existing, yet the courses are going on. So we felt that there should be rotation of the student from one to another places, so that first they should have exposure to the subspecialties, and then they can make up their choice where to go for the subspecialty training after completion of their DRNB and MCH. Try to learn that, and in future the public is going to demand, like, for example, are you an endovascular neurosurgeon? Are you a person who do epilepsy surgery, epilepsy surgeon? No, no, these are the subspecialties. So in down the line, maybe another decade or maybe 15, 20 years, these subspecialties are evolving like anything. Very fast growth is happening in this, and all the students should eventually focus in choosing their stream. Like they chose neurosurgery, it is no longer becoming to be the dead end of it. One will have to choose subspecialties subsequently in order to be master of one thing at least, and to be able to survive in this crowd of competition.
So you just listed down the subspecialties after neurosurgery. Sir, if you had to basically uh, give them a marking based on their potential, how would you rate them?
Of
Yes, sir.
subspecialties, no, it's very difficult. You cannot all are equally important, okay, with the no. But my experience has been like epilepsy surgery is going to be in big demand. Functional neurosurgery is a part of epilepsy, like deep brain stimulation for Parkinsonism, whereas psychiatric disorders which are falling into the domain of neurosurgery treatment, and we are very sure in a few years we'll have much more number of cases which will be done. Then pediatric neurosurgery is going to be a demand always. बच्चे हैं तो problem है तो है ना, तो आएगा वो तो. So that will be another area. Spine is going to be another big field for which is going to remain always. So to say which is better to another, no, it's not right way to put up. All are equally important. Their importance may change with the time. Today, what is number one, the other number three or the least may become suddenly high up. Like neurosurgery, nobody was going.
How much more potential do you think this branch has in the next 10 years?
Oh, lovely, बहुत सारा. I mean, it's, I'll say trauma is not going to end. Whatever may be, we're getting more and more trauma cases. Stroke is not going to end. We will get more and more stroke, neurosurgery. There is a rising trend of brain tumors in younger age group also. Okay, you're not going to be any deficiencies. Then spine, neurospine is not going to be. So I do not see any decline in neurosurgery, the routine neurosurgery. On the other hand, there will be, the gene therapy, advancement of the gene therapy for the treatment of various conditions. Unfortunately, like special child do not have treatment available today. So the work is on that. Maybe we can do genetic engineering or maybe do some kind of modulations in the brain. Okay, so those modulations can help in the revival of the function of the lost part of the body. I mean, it's happening. So I think there is still a lot of potential. Neurosurgery is going to remain. what you do in neurosurgery may change may happen. What somebody was doing 30 years ago and what we do, I mean, we do not do, but what was done is today, and what we do today is getting to get replaced by something else. So branch has a great future. No, it is not going to be a dying branch. Okay, it's not like a camera who is dying, it has been replaced, so it will remain like that.
Sir, many new doctors have this apprehension and fear. How will AI replace or maybe help doctors, maybe especially surgeons, in the upcoming future? What's your opinion?
I'm very clear about it. AI will never replace doctor. It is going to be additional tool for you to be used for the best of the patient care and for your own knowledge. So we debated it number of times. Whatever gradually things are unfolding, it is just a tool. So one should not be scared about. I think it will be AI enriched surgeon who will be able to perform things a better way, faster way, shorter way, better result. So I don't think one should be, afraid of AI. It should be welcomed.
Recently, you must have seen that AIIMS has done an X-ray. I think it's an X-ray or CT scan through AI, and they have computed a complete report with a diagnosis also. So
Yes.
अभी डर का माहौल चल रहा है.
Yes. But then it's good that you brought it. See, there is an issue here also. AI generated report. Vis-a-vis you and my generated report. Now, we cannot leave everything to AI to do and you rely 100%. Somebody has to sign it what AI has done. Suppose there is a litigation for something and AI generated report. Who's liable? Whose responsibility would it be? Would AI be sued? Would AI company be sued? Or somebody who has to, it has to be somebody responsible for it. So even today, AI generated signature reports, according to me, is difficult to be trusted on completely. And it is a report alone. Report has to be analyzed for the patient treatment. That has to be done by a doctor. So he cannot take decision because AI has said something. He has to match the clinical finding, the report. AI would read out which human mind may have missed out. That's basically advantage. That is why I said it's a welcome tool to help you in near zero miss or so minimal miss, so that you are not missing out something. It gives you a better differential diagnosis than your mind could comprehend at that period of time. So, on lighter note, I'll tell you, for example, when we were doing our MBBS and all, what the differential diagnosis of breathlessness. Now, today, if I count, maybe there are 20 causes of breathlessness, and we used to have in our books, there were certain books which had very good synopsis of the breathlessness. These are the pain in the chest. These are the things. Now, that was also some sort of AI kind of a driven result. Today, it is not in the form of a print material. It is a computer generated answers which you are getting on your mobile. So it gives you a ready answer. Rest, you have to apply your brain to see what is the right kind of a diagnosis. So I think it is to be seen by the treating physicians and the doctor. Time will be there. Everybody will use AI for their routine application, and it will be freely available.
True. They are basically getting everything done by the AI, and only doctor. The only reason they need a doctor is to put the liability on somebody.
Yes, you will be liable for because you have to sign. I mean, radiology AI has been, now it is becoming a part of life in various places. Tele consultation, telesurgery. You must have heard. We call it as telesurgery now. We used to read it about telesurgery. Now it is possible to do it. I mean, tele-reporting. I mean, they are very good. I'm sitting at home. My residents used to send me the pictures immediately at home. I mean, you'll be surprised. There was a time we used to send the images of CT scan to our consultant at his residence in the night to make a decision what is to be done. Okay. So imagine, scan has been done. We used to collect those scan because we were in the learning phase. We were not supposed to take decision. There used to be one orderly from the ward who will take the ambulance from the hospital, take those X-rays and CT scan, go to the consultant home. Consultant would see those CT scan, then make a phone call to us, do this. Now, this used to do 3 to 4 hours of wasting, arranging ambulance, looking for the orderly, taking an X-ray, sending him, waiting for the final. Now it is instant sending. So, that is the advantage. You can instantly send your images to the consultant, or the PAC system, you can see yourself from home and make decisions. So, that's also intelligence.
True.
Yeah.
I'll ask you a little bit of a political question here.
Okay.
So why do you think doctors are so underpaid in our country? I mean, compared to US, I mean, US तो सर अलग level चला गया, even Dubai or Australia.
I was in US last year, and same question was asked to me by the neurosurgeons there when they came to know how much I am getting. So they said, why are you working? Why do you work to this? Is this a money for which a neurosurgeon should be working in the public sector? So I said, look, I mean, that's emotion. I said, this is what we work, this is what we have been paid, and we have adjusted to that kind of salary structures. But then why the doctors are being paid less? Because I think, I'm very precisely honest, doctors are accepting it to be paid. We need to somewhere put up things. If you want a difference between a medico versus non-medico, one should understand there is a cross difference in the preparations of a medicine boy or the doctor. There is a gross difference in the number of hours to be put in their learning and subsequent commitment. So I think unless the nation or unless the public, unless the government realize this, this is not going to solve anything. That's the reason, we have started accepting. If by virtue of, I'll say, generosity or maybe respect to the profession, or they may be the just kind of demand, the parity with other profession has to be differentiated. Medicos, unless you pay them well, your health system is not going to work out. Be ready. You will be spending of crores of rupees in finding an unnecessary solution which be eventually a waste, rather than giving a simple solution. Pay them well so that they do not feel let down by having taken the medical profession. And that's a cause of concern. The best brain are not opting for the medical profession. You'll remind, I just said when we were student, there was only one profession, medicine and engineering. Medicine superseded the engineering. Today, the best brains are not coming for the medicine for the same reason, because the realization is that itna kaam karo, itne hours kaam karo, yet we are not rewarded when. And then the government has to understand, like there is a lot of time has already passed in finding ancillary solution rather than giving a simple solutions of helping the doctors. And majority of the profession who have taken medicos, they are kind-hearted people. They want to work for the patient. They understand. Till one feels, 25,000 rupees to a doctor. Can you imagine today? Is it a salary? Driver is getting much more than that. Okay. When I go to see some nursing home doctors, how much? 25,000 rupees, 30,000 rupees is salary to a doctor who is MBBS or equivalent to MBBS. So, rather than what is happening is we are trying to have ancillary system of the medicine, trying to bring them into the level of those which have done studies like standard system, equating them. It cannot happen. That will not be solution.
Absolutely.
Yes.
And uske baad bhi you are always afraid that somebody can come and beat you up.
Oh, yes. The violence is becoming, violence it's a society by and large requires treatment. We are having, it's not over India alone, all over world, particularly Asian country, the violence against medical profession is alarmingly rising, and there may be a number of reasons beyond this topic to discuss right now. But then, yes, India had been considered as one of the most tolerant society. If India is landing into those situations, I think we need to redefine ourselves.
इट हैज़ बिकम सच अ लाफिंग मैटर इन आवर कंट्री. आप रोज़ पढ़ते हो कि कोई डॉक्टर कहीं पिट गया है, एंड इट्स जस्ट अ पासिंग न्यूज़ नाउ कि हो
So
गया
so
ये.
sad, and underpaid, violence. So where we have had strikes, we have had every day it is going on. So IMA level, DMA levels, national level, government level, yet nothing is happening. Somewhere, the public need to be told the respect to the medical profession. Unless they are aware, it will continue to happen. And can you beat uh, I'll say, I mean, I'll not say that way. If you say the public by and large can beat anybody today, be it a police wala, be it a DCP, be it an only deterrent is if they see four people surrounding them as their security, they may deter. It is a deterrent now. That's the reason hospitals have started deploying the bodybuilders standing all around this way. Okay, that is how it is happening. Otherwise, when we were student, there was used to be one orderly, one person. The days were very simple. I mean, no security, no threats. Today, by and large, public demands and expectations, we are having a generations of wild public coming up now. Okay, and there may be different. It's a different subject altogether, which one has to be careful of.
So you chose a career in the government sector. You have been a government servant for last 35 years now, over a corporate one. Any reason behind it?
Why I chose government sector?
Yeah.
Oh yeah, very simple. See, when we were in the beginning of the career, we had only government sector. One, I was keen in academics, teaching and all, so that existed in government sector. So, but then last 2 decades or so, the transition has been so much that the private sector is offering better healthcare delivery. And now the education is also shifting to the private sector, medical education I'm referring to. And I think, given an option by the parents, people and the student will still choose going to the private sector for even medical education today. You can understand those who can pay will opt for the private sector because they have paying potentials. Those who are going into the government sector are those who have ranked better during their profession. They'd have to pay less fees and they have gone. If for some reason there is equal fees in the government sector and the private sector, even the people will start opting the private sector, particularly for their post graduation and all, because private sectors are much more equipped in terms of the infrastructure. Now, the advantage of the government sector is a huge kind of number of patients which you get to see, which you get to operate and all. But then, in terms of results being produced in any kind of a disease, the private sector is producing better results because they are result oriented center. They are producing, they're having better facility, they run after, the results are better than the government sector. Private sector, it is the senior people who are on the hands of affair to operate and look after the care, whereas the government sector, it is left to the resident level, whereas it is good for the resident to learn. That's the learning stations for that. That has been the reasons of decline of faith in the government sector.
They're opening up colleges like मुझे याद है AIIMS. They're opening up like crazy. Every year they're opening up 2 to 3 AIIMS. So जो AIM का वो नाम था, वो quality थी. Of course it is going to come down.
No, actually, when AIMS started, even we felt, "Okay, what is happening? Why so many AIMS?" And we were also little reluctant. But over the last few years, I have changed my opinion. I'll tell you why. The opening of AIMS has been various AIMS have been advantage of number of ways. They have created, the government has created AIMS with matching infrastructure is that of AIMS Delhi. That's a very good positive step. At least various states are having center which is well equipped, matching almost everything. then even in those aims, at least those who are keen in academics are joining it. Okay, they are getting all aims like facilities which aims Delhi has it. That's another advantage. And I have realized they have started delivering also, if not equivalent to aims Delhi, at least 50% of aims Delhi, the services are being delivered in all aspect which is needed today. So we are happy to see, at least I'm happy to see what we conceptualize at AIIMS opening up various places, but then it is delivering. That's the right step. Maximum could have been why the name AIIMS has been given. It could have been given some other names. That is what I feel. So we joked with the AIIMS team, last dean of the AIIMS, said write down AIIMS logo, नीचे लिख दो हमारी कोई branch नहीं, शाखा नहीं है. We are AIIMS Delhi. So that was a joke. But then, yes, it has been a fruitful step. Not in terms of saying it all AIIMS, but or for those states which generated employment, people have joined, people are working, now they are in competition. And I'm very sure in few years' time there will be intra-AIIMS transfers also, which will happen from AIIMS Delhi to A place or Rishikesh or Patna or other places. So that way.
Sir, my second opinion, a little different, was why not basically make the state GMCs, the government medical colleges, better?
Yeah, I mean,
I
that's
mean,
what I was trying to
इतना
say.
पैसा
Rather
आपने
than,
इस पे लगा दिया, हजारों करोड़, जीएमसी पे लगा लो. जीएमसी हालत इतनी बुरी हो रखी है
so
देश
I'll
में.
tell you one the reason. One is central government center, and another is
of
the
course,
state
yeah.
government. So funding is the thing. Government, central government finds it's easy to have a funds to allocate and do. That's good. And government, I mean, state doesn't have to do it. Okay, if the center is sponsoring money and all of this, why would I spend my money to the government setup? That is what my understanding is.
Yeah, it becomes a win-win situation even for the people.
Yes, people is benefited, center is benefited, even the state feels okay, it's good to have AIIMS. On the other hand, I'm aware every state has started demanding AIIMS now. And in some states, they're demanding more than one AIIMS also. So this is happening. You have places, two AIIMS within the vicinity of 60 kilometers. So that is also happening.
So, sir, in the government sector, did you get also some non-financial advantages that you might not get in the corporate sector?
Yes, certainly yes. Non-financial, I'll say not in terms of money,
Yep.
but then we used to get academic leaves, which was a month of leave in 1 year, paid leaves, which allows me to attend various conferences, to take exams, to present my papers, or any other academic related activity which was there to travel across the country, which according to my mind was a very big asset to us, okay, which was not there earlier. This all came with a struggle of asking for more in for the academic purposes. And Delhi doesn't have much of a financial support. AIIMS has. AIIMS, or they're called Center of Excellence, which are there in India. They have the financial support also, like traveling for international, attending conferences. So they budget your ticket. You can take ticket, travel, and all. But that is the kind. But then again, I said it is not matching with what AIIMS get or this way. If AIIMS get 4 international visit, we may get 1 in 4. They may get 1 in 2 every year. So there is a disparity. So for the same reason, slowly, I mean, we have not allowed the state to grow to a level which is there. There's no deficiency in the knowledge of the doctors. They are unable to attend various meetings across the world because no exposure.
So I'll ask you the most pertinent question of our podcast. How much can a neurosurgeon earn in his lifetime? I would say, immediately after his MCH or DNB, 10 years down the line, 20 years down the line.
Okay. So, if I say government sector, it depends where you are born, where you are working, various state. And also depends, some states are allowing private practices and other are not. Average SR salary is between 90,000 to 1 lakh rupees various places upper end, okay, with some increase every year. Whereas some of the state medical colleges or state, they are getting around 60 to 70,000 only, which is too low for a standard of neurosurgery. But then when you go on, and then you can grow up to 3 to 4 lakhs of rupees per year, depending upon if you reach out to the levels of professor, director, professor. That's the ceiling which you will be getting. And that's gross pay, कट के आधा मिलेगा आपको अपने सर्वाइवल के लिए. Whereas in private sector, there is nobody knows exactly, but my rough guess is some of the best neurosurgeons would be earning 1 CR a month also. Okay. But average could be somewhere between 6 to 8 lakhs of rupees per month. That would be the average. This is what my understanding is. From 6 to 8 lakhs to rupees 1 crore, there is a huge gap, you know this. So that is the one. But most of the people of a middle class level of their experience, for 10 to 15 years, will be falling in the bracket of 6 to 8 lakhs rupees per year, per month.
Thank you, sir. So, we have talked about that how sub-specialties are also now a necessity. Do you think, like, even in today's world, do general surgeons have any place, or doing an MCH course is an absolute mandate?
Yeah, that's very difficult question also, you know. The role of general surgeon in India in current scenario. Believe me, today, if I say answerings today, is to be seen in the perspective of 10 years down the line, because the surgeon has to survive those 10 to 15 years also. General surgery alone is gradually becoming difficult. And general surgeon may have to shift to the type B and C cities in order to survive. Whereas in a major city, I think most of the super specialties are taking over the things. And public has also started asking for specialist doctor for them. See, all GI has become a branch in itself. Plastic surgery is a different branch altogether. General surgeon has left out with a limited number of exposure and surgeries to be performed in most of the places. There may are some general surgeon doing exceptionally well. I'm not talking of them, but I'm talking of overall
generation, yes.
So general surgery alone is not going to be the last end of your professional degree requirement. One will have to look for the super specialty.
That's
And you know, we also suggested, like neurosurgery was the only branch which had the 5-year courses. So I said, why not to make every branches and 5 to 6 year courses?
Sir, you have seen both the people, both the students, 6-year DNB people and 3-year MCH course. I mean, did you find any difference between the two mindsets? Because the person who chose the 6-year course, he or she must be of the age of 22. And the person who has chosen the 3-year MCH course had better maturity, had chosen with different circumstances in mind.
Age group is largely same. You know, one has to spend 3 years, then 3 years of course. Whereas 6 years entered, let's assume they have entered in the same year, they have spent 6 years directly. So as far as the maturity level of age is concerned, exposure of somebody who has been 6 years in a particular field is better, his understanding is better, at least subject wise. Okay, that is what I felt is there. And we realize that also. Someone student who has spent 6 years, obviously it matters from the student to student also. Like we did 2-year course, we are not inferior to those who were doing 6-year course now. A lot depends upon the student also, how much he wants to learn, what is the passion in him, what is the force he wants to learn and apply to. But then as a whole principle, and it is a common sense also, more you spend time in a particular subject, you will have more knowledge and awareness.
So which are the fellowships that, the neurosurgeons can do abroad?
There are various of them. See, endovascular fellowships are there, epilepsy fellowships there, even the brain tumor fellowships are there, spine fellowships are there, stereotactic and functional fellowships are there. Depending upon what it is, number of fellowships are there. And at the national level, Neurological Society of India is also helping the student to, as a guide to counsel them which are the fellowships available there. They can talk to some of the members, senior members of the NSI, and they can guide them where to choose, what is the method, what is the financial support. We were giving financial support to travel also to the student who want to go present papers if their papers have been accepted. We are now planning to start fellowship on behalf of Neurological Society of India to the student to aware the fellowship. This is what we are doing as our responsibility to the student in upbringing the level of education. So the next thing we are also thinking, invite international people to learn neurosurgery here. And believe me, in a very short period of time, India is going to be a hub for medical tourism, huge hub. And it's not only medical tourism in terms of patient treatment. Many people from adjacent nations and the country are likely to visit to India to learn neurosurgery now. Okay. What we learned from abroad. Now we have a huge force of neurosurgeon in India. Approximately 5,000 neurosurgeons in India are there. Still much less in terms of the population. But then adjacent like Bangladesh, Sri Lanka, Pakistan, Afghanistan, various African countries, okay, the people are expressing their interest to come to in India to learn neurosurgery, various disciplines and fellowship. And I'm very sure many people are very keen to teach them also. Okay. Now we are finding out how do we imbibe that kind of a knowledge to them. What kind of financial support. They're also belonging to the average population of per capita income matching to the lower social economic groups, the lower income groups. So coming to them, whether India can support them. Okay, designing a system to support rather than we sending out a student, now we will be reversal. So ask them, we are in a position to teach them now. So train them also. So there are, people asking us, a student asking us, we want to come and learn. Unfortunately, we do not have the system of supporting them financially because we ourselves are financially in situations to survive ourselves. So that is it. But I'm sure in few years from now, there will be some schemes available for the international student to come and learn here.
So which ones would you say are the best institutes to learn MCH or the 6-year course in neurosurgery in India?
Oh, there are many. Okay.
Give us the top 5.
Top 5, I still feel AIIMS ranks the number 1 in most of the places. Then there are institutes of excellence, Sri Chitra, SGPGI, then GB Pant, Lucknow. There are many in South, Pondicherry, okay, Madras Medical College, CMC Vellore. There are, to name a few. Otherwise, I feel, to my understanding, my experience, Indian neurosurgery is evolved significantly. I have seen the growth and I see young neurosurgeon in the age of approximately 40-45 performing much better neurosurgery than what we did our time. And that's very encouraging, because, they have learned, they don't have to spend time on the basics of the thing. They have picked up from where we were at the peak. And now they are advancing over that. So we have become more experienced over a time. They have started with a new level of skill, which we developed over a period of time. We're very happy those people have learned those skills in a much shorter period of time. And I'm very sure, we have a great potential of neurosurgery in time to come for India. No doubt about it.
Sir, you have seen the industry inside out, the whole medical world. Out of all specialities, sir, top 5 specialities.
Specialties. Okay.
Which have the maximum potential in the next 10 years.
You're talking of all branches
All
of
branches,
medicine. Sir. Okay. See, neurosurgery, according to me, will still remain number 1.
Yeah.
Now, when I say potential means doing good work, not money here. Okay. gratifying work to be able to produce something which was not being done in the past. Neurosurgery is number one. Money wise, maybe oncology, oncosurgery will be superheading because the obvious reasons are there. Then plastic surgery, spine surgery, these are the things which are, according to my mind, good. There is a significant decline in cardiac surgery. Okay. Because intervention work has taken over significantly over that. Then hepatology, transplant. And in transplant, I will place over and above many of these branches. So many branches are coming. But then having said that, one has to remember, there is a time for everything, living or non-living, it has its own time. What scales to be the top may decline one day. Radiology was the most ill-preferred branch in 1960s to 70s. Nobody wanted. They were all called, ye to radiographers. They are not doctors. Became one of the most sought after the branches, and now again started declining. Cardiology was the offshoot branch. Suddenly there is a saturation and things are... So, pediatric neurosurgery didn't exist. Endovascular neurosurgery was not even heard of. Epilepsy neurosurgery is not even heard of. So newer things are evolving, and that is the law of nature. जो आया है जाना तो है, चाहे वो living है, non-living है, it has to die down one day.
Very true, sir. समय की बात है.
समय की बात है.
So now we move to the rapid fire round. कुछ चटपटे सवाल रखे हमने आपके लिए.
Okay.
So बहुत simple 2 rules. You have to be super spontaneous and super truthful.
Okay. Super truthful.
Truthful,
okay.
yes.
Okay.
Sir, if you had to do your own podcasts, you were the host, who would be your first guest?
Who will buy?
Who would be your first guest?
Oh my God, that's maybe my wife. Super fast. Okay.
Sir, if you could swap lives with somebody for a day, who would that be?
Myself.
Sir, still, एक लंबा guess मारो.
मतलब swap life with somebody else.
Somebody else.
Whom should we like to swap out?
I think
Somebody who has to be my ideal.
Elon Musk के साथ, if you could do that and
Not
you
at
could
all.
learn Neuralink कैसे कर रहा है.
No, I'll not like to swap with him.
Okay.
I would love to be part of a Neuralink team if at all, But not swap because I'm not convinced what he's doing is really a good thing. But swap is something you would ideal person for your others. Okay. Very difficult. Maybe Guru Nanak.
Yeah.
You never know. They're different league altogether. Okay.
Okay, so I'll ask you a follow-up question.
Yes.
Let's suppose you were in the Neuralink team.
Yeah.
What would be your first question?
Am I doing right thing?
Ethically.
Ethically. That's the question.
And do you think that it's what they're doing is ethical?
I think it is ethically correct. They are following the right way of ethical it is to be done. Every new thing should be subjected to questions and we should face it. And once we get answer which convinces you morality wise, ethically wise, then you think you're doing right. After all, the aim behind this is the goodness for the something which is not treatable. So if I can treat, if I can make some paralyzed person to walk with a chip implanted to the spinal cord. I did bone marrow transplant in the spinal cord. I did omentum transplant in this spinal cord. The results are not gratifying, but these are the things which were acting. Today, this is computer interface devices, that's a Neuralink kind of. These are being tried. Whether it will work or not, I have my own question mark. Okay. I doubt the results will ever be fruitful. That's my today's statement. If it becomes fruitful, I'll be the most happy person. Okay. Because somewhere we understand the science. Whether we'll be reaching to that level, see, human brain, spinal cord has developed in 40 billion years. And if you think we can match that evolution in a research of 40 years, that will be phenomenal. Okay, let's see what happens.
So what's the one thing of the brain that has surprised you all throughout your life?
Everything. Still I know nothing about the brain. Everything, whatever knowledge I have about the brain is proved wrong each and every day.
Okay, most spectacular one that you can think right now.
Work of,
Most spectacular thing about the brain that you can think of right now.
oh, the most spectacular is itself, the brain itself is so spectacular. I mean, how it works. I mean, till today, I have no answer to either the functioning of the brain. We debate, we understand everything. You learn more, you're more confused. You learn more, you're added on confusions. So there is nothing spectacular to be very happy. But then, yes, the spectacular is that there is nothing understandable about the brain even today completely. That itself is like a universe. The brain itself is a universe. Exploring universe is not going to be a one-day job. I'm just traveling to that universe every day, and I'm confused. Every day we are confused. Oh my God, we thought, there is a saying, what? जो ब्रह्मांडे सो ही पिंडे, जो ब्रह्मांड में है वो आपके शरीर में है. सो इफ यू कैन नॉट एक्सप्लोर द ब्रह्मांड, वो आपके शरीर में नहीं है. वी एक्सप्लोर ब्रेन. somebody comes someday, there is a new structure identified in the body. Okay, I'm surprised अब तक क्यों नहीं पता लगा था. While we're sleeping, we are discovering new circuits in the brain every 5 years. Our understanding of various functions and the circuit of the brain is changing. Our understanding of the, beside electrical network, the chemical networks of the brain is also changing. What we believe that is a chemical involved in the transmission of the nerve conduction from acetylcholine to other, there are a number of new chemicals are being added on every day. So I'm finding it becoming more and more confusing. And maybe, and I may be wrong, I may be totally hypothetical, the brain itself is changing. Okay. Over the years, further, the brain is changing, the shape of the brain is changing, the circuits are redefining itself. It's becoming an auto computer by itself. What we are afraid of AI may take over, not only, maybe the brain is nothing but a part, something's adapting to various circumstances by itself. It is happening in the brain. So that's why I say brain is a huge thing to be understand, and there will be no end of learning for the brain.
Thank you so much, sir. It has been great hosting you. You have been a wonderful guest.
Thank you so much. Wonderful to be with you, and very interesting questions which you have worked us so far. I'm glad you asked some very interesting questions.
Thank you so much, sir.
Relevant to everyday practice in neurosurgery.
So that's the reality that we are trying to share with our audience.
I hope audience finds something useful.
I am 100% sure, so they are going to love this.
Thank you.
And thank you so much, everyone, for watching today's show. I think sir has given us a great insight about neurosurgery and the whole medical field. So go ahead, choose neurosurgery, but be ready. It is going to be a hectic branch. Thank you so much. And as always, do not forget to like, share, and subscribe. Thank you, and God bless you.